Hi, I'm Dr. Sam from Southern Cross Vet, and today I'm going to show you some of the problems that brackies have breathing and what we can do about it. So I've got little Pug here. She's 5 years old, and for the past year or two she's been having breathing problems. You can see her little nostrils here are what we call stenotic, or more like vertical slits rather than circles that normal dogs should have. And you can hear her grunting too. All of this makes her more tired at the park, and her recovery after running around at the park is a lot longer than her friends. So today we're gonna do a procedure on her called the BOAS surgery, and we'll walk you through exactly what that involves. So we're about to start the BOAS procedure here. Down the back of the throat in every brackie that we see, there's this long curtain-like tissue that hangs down, dips into the windpipe, and makes that characteristic snortling sound. So the main component of it is a shortened schnoz here, compacting all the soft tissues of the sinuses into the front of the nose. The second main component is this really long, elongated soft palate, which can dip into the larynx. And the third component can be laryngeal collapse here. So I'm going to talk to you about these three components and what we do at Southern Cross Vet differently to correct them. So to start with the most important part, the soft palate here. So best way to think about it is the roof of your mouth that you can feel inside your mouth. That hard part is called the hard palate, and it extends as something called the soft palate, which is this fleshy sort of material, very important structure to help dogs swallow and not inhale their food properly. And it closes over when they breathe in, so that the food does not go down into the windpipes. Very important. But sometimes in these brachy dogs, as we've bred them over generations to have shorter and shorter schnozzes, the soft palate has remained just as long. And so a normal dog's soft palate would end about here. What you're seeing in brackies is a much longer soft palate that dangles into the larynx here, causing obstruction. So that's the kind of sound that you can hear when they're snoring, that snortling sound that we often think is cute or characteristic for a Frenchie or Bulldog, but it's not. It's actually the soft palate fluttering here, vibrating, causing an obstruction in the larynx. What's the big deal with that, you might ask? Well, ongoing obstruction means that the dogs need to take deeper and deeper breaths with more force, and kind of like when you're drinking a McDonald's thick shake, for example, if you've got a small straw and you're trying to suck in the milkshake with a lot of force, the straw can collapse. So too is the same thing with our brackies here. So the windpipe, you can think of like that straw drinking the milkshake, and if you're having to suck and move air into your lungs with more and more force, because this soft palate is blocking half of it, blocking the opening of the straw, if you like, then you can have a tendency for this larynx to actually collapse inwards. Once you've got laryngeal collapse here, there's very little you can do about it surgically. So that's what you really want to avoid by shortening the soft palate. What we do differently here is we use the Cayman, which is an electrosurgical device that seals, uses radio frequency to seal the collagen at the back of the throat, and then cut to remove all the tissue within about 12 seconds or so, saving about 40 minutes of anesthesia time. So we're going to get stuck in now and show you on the other side. Looks good? Yeah. So now that I've removed all that excess tissue at the back of the throat, Pug's breathing a lot better already, and we're going to move into the second part of the operation now, which is to widen the nostrils to make it even better. The other part or bottleneck in brachycephalic airway surgery that we correct at Southern Cross Vet is the nostrils. So the nostrils up here, they can be very slit-like and not open holes, and causes more resistance to airflow, leading to the same thing. More resistance here leads to more resistance here and could lead to laryngeal collapse. So by opening up the airways, you allow more airflow through, by getting rid of the excess length of the soft palate, you're eliminating the second bottleneck there. So that's us all done, the BOAS surgery complete. I'm really happy with the result. I think she's breathing better already actually. And so now the surgery's done, that's the easy part, and it's going to be over to Scott, our anaesthetist, to complete the recovery process. A lot of the time when we did this surgery previously, the procedure was quite invasive actually. We'd have to clamp on the soft palate at about this level here, where the line is, cut it off. There'd be a lot of bleeding at this time. We'd place maybe 15 to 20 absorbable suture materials there. But the trouble with that is it leads to irritation at the back of the throat, a lot of swelling, hemorrhage, and most of the time we'd send these patients in the immediate post-op period to a 24-hour monitoring facility, just in case they'd obstruct. Some of them would obstruct afterwards, needing what's called a tracheostomy tube, which is a hole put just at the base of the larynx, because this whole pharyngeal area is so swollen post-op because of the traumatic way that we used to do it. It was really quite risky. But at Southern Cross Vet, you might have read in the newspapers recently, we've pioneered a new technique using a human surgical device called the Esculap Cayman that seals the XF's soft palate there without any clamping, zero bleeding, no bruising, no suture material. Cuts down the operation time by about 45 minutes to 12 to 15 seconds, and absolutely no need to go to the emergency for monitoring in 99% of our cases. So because of the lack of invasiveness of this procedure, we're seeing us do the BOAS corrective surgery even preventatively on dogs to avoid them having to develop brachycephalic airway syndrome. So it's often a paradigm shift for owners with these dogs. Now they're able to think, well, at the time of desexing, why not correct the anatomical abnormalities so that they don't develop this syndrome needing more urgent surgery down the track.
All right, so here we are at the end of the anesthetic. This is the recovery phase. And the anesthetic itself for the surgery was perfect, but it's actually the beginning and the end where the most amount of attention needs to be paid, and the benefit of having dedicated anesthesia is really seen. These airways of these guys are still very small, so as we recover this guy and bring him back to consciousness, that's where the benefit is, and that's what I'm going to be paying attention to now.
My name is Jess, and this is Russell Pierre, my 2-year-old French Bulldog. So happy that we went to Southern Cross for the BOAS surgery. Russell had a super fast recovery and is now running around with his mates at the park, and no more snoring.
Come here, honey. How's you breathing, buddy?